Evans with Angel Kids Pediatrics. I'm here to talk about the novel 2019 coronavirus or COVID-19 pandemic that's currently going on throughout the world. This is a newer strain of the coronavirus that is impacting people all over the world. People who are more at risk are infants younger than the age of 1, older adults, and those with comorbidities that put them at risk. There's not a lot that we know about the coronavirus. It's a newer virus, but we're still learning a lot about treatments and how it's presenting in kids. And so this video is just to kind of talk about the presentation and what we're seeing and what we can do to help prevent it, how we're treating it. So there was a study in the United States that looked at the pediatric population presenting with COVID, and it looked at symptoms that they're having. And while adults usually present with fever, cough, and shortness of breath, younger kids are presenting with more variable symptoms as well. They do still present with fever, cough, and shortness of breath, but they can also present with muscle aches and pains, sore throat, runny nose, nausea, vomiting, diarrhea. So they can have a more broad spectrum of symptoms. So it's definitely something that we need to think about in kids, not just as cough and shortness of breath, but as other things too. Some patients do have worsening symptoms the second week of illness, but this isn't something that's classic in kids either. 1.7% of the cases in the United States were in the pediatric population less than 19 years of age, so it's less common in the pediatric population compared to the adult population as far as our testing is what they found in this study. Infants less than 1 year of age were more likely to be hospitalized compared to other age groups in the pediatric population. So as we noted before, infants less than 1 year of age are definitely at higher risk for more severe symptoms with the COVID-19. So as far as treatment, there's currently not any specific FDA-approved treatment. There's lots of different medications and vaccines that are in trials right now, but currently the main state of treatment is supportive cares, so limiting symptoms with fevers, keeping them hydrated, and those kind of things. There is a multi-system inflammatory syndrome that's occurring that we're still learning about. It's something that's been described more recently. This is an inflammatory syndrome that occurs, it's described kind of as having fever. Sometimes it affects some of the organs, and so they'll present sometimes really, really sick little kids. And a lot of times they'll have inflammation on labs. So these kids present about 4 weeks or within 4 weeks of exposure to COVID, and so this is a new thing that we're seeing. So certainly anybody that's been exposed to COVID that has new fevers that are persisting needs to be seen kind of more emergently for further evaluation. As far as testing, there's several places in Jacksonville that do testing. You can be tested for whether or not you've had it in the past or if you currently have it. So if you're interested in testing or have any questions about testing, please feel free to give us a call. That's what we're here for. As far as prevention and limiting the spread of it, there's several guidelines out on how to prevent the spread of it. CDC recommends social distancing, so trying to limit your exposure to others that could be carriers of it. And then face mask coverings, either by face mask or like a face covering, can also limit your spread and exposure of it as well. And then frequent hand washing or using hand sanitizer can limit your transmission as well. AAP, the American Academy of Pediatrics, does recommend children younger than 2 should not wear face coverings due to suffocation risk. But they do recommend it in general in children older than the age of 2. But one consideration to think about is how frequently they're touching their mask, because that can increase your risk of transmission by touching objects and then touching your face mask and adjusting your face mask and touching objects. If you have any other questions or concerns about COVID, that's what we're here for, so please feel free to reach out to us. And we're here for you. We're all in this together. Have a